for my skin of color patients, I like to recommend a physical sunblock with an SPF of at least 30, ideally 50 or higher. And the reason being is because what we know is that with a good SPF, it's going to protect you from just the UV, ultraviolet, and some of the visible light rays that are damaging to the skin. It also helps protect you from some of the oxidants and the pollutants that are in the air. And what I like to tell patients is that from a prejuvenation standpoint, what the sun SPF is going to help you do is it's going to prevent the sun from breaking down your collagen that leads to these small, fine lines and wrinkles that some of our patients start to see even in their late 20s and early 30s. I also like to talk to my patients of color because a lot of us sometimes will collect these tiny little moles on our face that are actually called DPNs, or dermatosis papulosis nigra. And we usually say that we collect them from our grandmothers, but what most patients will notice is they have more on the left side of their face than the right side. And I like to explain to them that's because it's our driving side and it's getting more sun exposure. And so for a lot of my patients, especially of skin of color, who kind of think, well, I don't really need to wear a sunscreen because, I have more melanin in my skin that should protect me. I explain to them that they are also at risk of developing some of these kind of small epidermal lesions that happen as a result of sun exposure. So a lot of times when I tell patients about either the tiny little moles or fine lines and wrinkles, that's a game changer to get them to understand that sunscreen is a really good prejuvenating tool for all skin types.